Are you experiencing front of hip pain, whether you're sitting, you're working out, or you're getting up, and it keeps coming back over and over? There's reason for that. And it's rarely because you just have tight hip flexors. When we see people that start to have front of hip pain, most of them have actually tried fixing the problem. So they'll stretch their hip flexors, they'll foam roll their legs or their glutes. Sometimes they'll just rest and stay away from any activity, but it keeps coming back over and over no matter what. And it keeps stopping them from doing the things that they want to do. Here's what's really going on. Front of hip pain tends to be overloaded front muscles with weak back glute muscles, the inability to really stabilize the core to allow those glute muscles to fire, and then the hip joint isn't working the way it should. All of those add up, and then we start having really bad, poor mechanical movements, and those movements turn into movement patterns, and we get stuck in the same cycle over and over. An example of somebody who might have this problem is someone who sits for a living. We sit, we do computer desk, my hip is flexed, so that becomes nice, shortened, and tightened. My glutes become lengthened, and they're not activating properly. So, what do? They stretch, and it feels good temporarily, but we didn't change the motion of the joint. So the problem comes back again. Here at Restore Chiropractic and Rehab, we want to look at the big picture, what's really going on. So we want to look at what's happening with hip joint mobility. Are those overactive front muscles needing to be addressed to calm them down? Are the back muscles needing some more control and strengthening? So, what we do in our office is we really try to focus on the chiropractic adjustment to help make sure that mobility is happening. We do soft tissue therapies to help calm down those overactive front muscles. We do dry needling sometimes to help the irritation of the tissue kind of balance out that the front and the back, the tone matches each other so the hip joint is balanced. We have rehab exercises that we want to follow up with to actually strengthen those glute muscles and teach our patients to stabilize the core at the same time. And then sometimes for those really stubborn tissues, we have laser and shockwave therapy. When those have been going on for so long, it's really a chronic problem at this time. If you are dealing with front of hip pain, these are the things I want you to focus on. Make sure your hip and your pelvis are actually moving well and mobilize them often. Don't just stretch. Make sure you're activating and rehabbing the posterior chain of the glutes and stabilizing the core. And most important, follow an actual exercise routine that progresses with you as you start to get better and notice those movement patterns are really improving. Because lasting change comes from fixing the problem, not just chasing the symptoms. So, if you are local and in the Lawrence area and you're having front hip pain, we'd be more than happy to help you find out what's actually going on. And if you're not local, now you know what to look for to actually make a change so the same thing doesn't keep happening over and over.